name is Tiffany and I'm a nursing student at the Glacier Hills Care and Rehabilitation Center. I'm going to present a patient to you right now. The patient is an 89-year-old widowed Caucasian female. Her former job was a nurse midwife. She practiced in hospitals and even did some frontier and industrial nursing. She has since retired and her usual source of medical care is at St. Joseph Mercy Hospital. Her vitals were taken at 11:30 a.m. on April 8, 2014. They were recorded as follows. Respirations were 14 breaths per minute, heart rate was 88 beats per minute, temperature was 97.8 degrees Fahrenheit, blood pressure was 130/84, and patient did not report any pain. All vital signs were within normal range. The patient was transferred from St. Joseph Mercy Hospital and was admitted to Glacier Hills on February 4, 2014. Her reason for seeking care was for rehabilitation after her pacemaker installation. Her pacemaker surgery left her very weak and is on a 5-pound restriction. Her goal at Glacier Hills is to regain strength and be able to walk again with the assistance of a walker. History of present illness. On December 30, 2013, the patient suffered a myocardial infarction and a stroke at the same time. She was rushed to the emergency department at St. Joseph Mercy Hospital and had a pacemaker installed 10 days later on January 9, 2014. The stroke left her very weak and caused mild macular degeneration, affecting the peripheral vision in her left eye. Post-op, she began physical, occupational, recreational, and mental therapy on the rehab floor of St. Joe's. Physical and occupational therapies occurred 1 hour per day, 5 days a week, while recreational and mental therapies occurred once a day, 5 days a week. In recreational therapy, the patient played games and did hobbies like baking and shopping, and in mental therapy, she would be asked questions that require logical thinking. After 2 weeks of her therapy routine, the patient's pacemaker wires became disconnected during physical therapy. She was then transferred to Glacier Hills and put on a 5-pound restriction. She is now in a wheelchair with some movement in her arms and legs, but is still very weak. Her new rehab plan at Glacier Hills requires her participation in physical and occupational therapy, each for 1 hour a day, 5 days a week. Health history. The patient was diagnosed with acute onset Guillain-Barré syndrome at age 27 in 1951. She had collapsed while working at the hospital and was paralyzed completely. She had made a nearly complete recovery, but has been weak ever since. She was able to be mobile without a walker until 10 years ago in 2004. Patient complains of bad osteoarthritis in her left hand and knee and also has some osteoporosis. Patient also has hypertension, but it has been stable for the past 25 years because of medication. All of the patient's immunizations are up to date, and the patient's last tetanus shot was in 2012. The patient has no food or seasonal allergies, but has a drug allergy to penicillin. The patient was hospitalized as a child after having a severe anaphylaxis in 1984 and again in 1951 upon acute onset of Guillain-Barré syndrome. While she was in nursing school during her late teens, she had an appendectomy and also a cholecystectomy, a gallbladder removal, in 1992. Current medications. The patient is currently taking a multivitamin, 1 tablet by mouth once a day, oxybutynin, 10 milligram tablet by mouth once a day to treat incontinence, vitamin D3, 400 units by mouth once a day. This enhances absorption of calcium, iron, magnesium, phosphate, and zinc. Miralax, a powder to be mixed with water, 17 grams by mouth once a day. This helps with constipation relief for GI upset. Baby aspirin, 81 milligram chewable tablet by mouth once a day. This is for anticoagulation. Diazide, 37.5 and 25 milligram combination of drugs, tablet by mouth once a day. This treats edema and hypertension. Lisinopril, 10 milligrams by mouth once a day to treat hypertension. Ocuvite, 1 tablet by mouth once a day to treat macular degeneration. This has lutein vitamin in it. Calcium carbonate, 1,500 milligrams by mouth once a day. This treats upset GI and heartburn. Levothyroxine, 75 micrograms by mouth once a day to treat hypothyroidism. Colace, 100 milligrams by mouth once a day to treat constipation. Pantoprazole, 20 milligrams by mouth once a day to treat acid reflux. Clopidogrel, 75 milligrams by mouth once a day. This is taken to help prevent stroke, myocardial infarction, and other heart problems. The patient is also prescribed medications to be taken as needed. Acetaminophen, which is Tylenol, 650 milligrams by mouth 4 times a day as needed. Bisacodyl, 10 milligrams suppository as needed. Miralax, powder to be mixed with water, 17 grams by mouth once a day as needed. This is for constipation relief for GI upset. Nitrostat, 0.4 milligram tablet every 5 minutes times 3 doses sublingually as needed. This treats myocardial infarction and opens up all blood vessels. Functional assessment. Patient doesn't drink and has never smoked or done drugs. She likes to drink tea because coffee gives her heartburn. She doesn't have any problem sleeping and doesn't nap often. She also doesn't have any problems eating, and she tries to maintain a healthy, balanced diet. She likes to read, watch TV, and do puzzles. Prior to her myocardial infarction and stroke, she would bake a lot and she enjoyed gardening. Psychosocial data. The patient was born and raised in Ann Arbor, Michigan. She is the second oldest of 4 children, 2 males and 2 females. Her husband passed away 10 years ago because of cancer. It started out as prostate cancer, but he eventually died from leukemia. The patient has 2 sons, several grandchildren, and a great-grandchild. She considers herself religious and is a practicing Protestant. Prior to her retirement, she was a nurse and later specialized in midwifery in Kentucky. Family history. Patient has a family history of heart disease on her mother's side of the family, and cancer is common on her dad's side of the family. Both her older and younger brothers had open heart surgeries with multiple bypasses. Her younger brother died after a myocardial infarction. Her mother had hypertension and died at age 86, and her father died at age 65 due to a cerebral hemorrhage. The patient assumes that he probably had hypertension as well. Review of systems. The patient considers her current health to be good and she is satisfied with it. Her weight is stable, but her energy is not as good as it used to be because of her old age. The patient does not experience any fever, chills, night sweats, or excessive fatigue. The patient reported that she notices more cold intolerance as she ages. I first reviewed the cardiovascular system because the patient recently had major heart surgery to have a pacemaker installed. Patient does not experience any chest pain, arm, or jaw numbness. Patient reports a history of heart disease on her mother's side of the family and has a family history of hypertension. Patient has hypertension too, but she has had it under control for the past 25 years with her medication. Patient does not have any heart murmurs, palpitations, or any difficulty lying flat. She typically sleeps with just 1 pillow. Patient notices less exertion tolerance as she ages and experiences fatigue after her physical therapy sessions. Also, since patient is very weak and on a 5-pound restriction, she can't walk and is wheelchair bound until the completion of her rehab. Next, we interviewed the patient about her peripheral vascular health because her recent heart issues could affect her body's blood circulation. The patient complains of slight pain in the left groin area. This is from the heart catheter being threaded through the femoral artery. She has edema in her legs and doesn't have hair loss in her extremities. Patient once had phlebitis in 1984 and does not currently have varicose veins. Physical examination. The first system assessed was the cardiovascular system. The patient has a nearly healed 2-inch scar on her chest where the pacemaker was installed. The patient's shoulders appeared to be narrow and kind of hunched in, but this is because of her arthritis. Coloring and contour of the chest was normal, and no lifts or thrills were palpated over the 5 key areas. All 5 key areas were auscultated with both the diaphragm and bell of the stethoscope, and heart sounds were normal, meaning there were no murmurs, S3 or S4 sounds. Heartbeat was moderately strong and maintained a steady rhythm. The next system assessed was the peripheral vascular. The patient has edema in lower extremities and no varicosities and bad osteoarthritis in her left hand and knee. This was evident because the patient had some shaking. Coloring and hair distribution of extremities appeared to be normal, nice and pink. Next, I palpated the patient's temporal, carotid, brachial, radial, femoral, popliteal, posterior tibial, and dorsalis pedal pulses. I was unable to palpate the popliteal pulse, and there was not a Doppler available. All other palpated pulses received a 2+ rating. Patient did not report any tenderness upon palpation of the lower extremities, and the skin temperature was normal. Patient's capillary refill was a little bit slow. It took about 4 to 5 seconds for complete capillary refill. A normal capillary refill takes about 3 seconds. Pertinent systems. 2 other pertinent systems that could be assessed on the patient are musculoskeletal and abdominal assessments. A musculoskeletal assessment is pertinent because the patient previously suffered from Guillain-Barré syndrome, which left her paralyzed. She eventually made a nearly complete recovery, but has always been weak. Also, because of her recent surgery, she has been in physical and occupational therapy because her movement has been greatly affected and she is currently wheelchair bound. According to the American Stroke Association website, which was last updated in 2012, stroke often affects the musculoskeletal system by limiting movement on one side of the body. An abdominal assessment is pertinent because the patient has been prescribed daily medication to treat constipation and indigestion. According to the journal article updated in 2010 from the National Association of Orthopedic Nurses by Marie Lindsay, titled Abdominal Assessment, an abdominal assessment can be used to check motility in the bowel and make sure everything is moving through the GI tract smoothly.